Hi, everybody. It's Dr. Laura Hanson with Connect My Brain. I'm so excited that you're here. We've been working on a series regarding child development. We've been looking through a cascade of parts that all play together. There's not just one thing that influences how a child is going to develop. It is the entire environment. And it's not just the environment on the outside, it's also the environment on the inside through that pregnancy, even prior to that at conception, the state of health that mom and dad are in. We've been looking at all these pieces and how they play a part in what we see today with so many children struggling to learn, to advance themselves, to be part of the environment. We have so many kids that are really struggling. It's actually estimated that 1 in 5 kids has some type of learning challenge. It could be mild, it could be severe, it could then go into a label like autism, Asperger, ADHD, all the subcomponents of that, as well as oppositional defiance, OCD, progressive developmental delay. I mean, the list is endless. We even have clumsy child, executive function dysfunction. There are many labels. In looking at child development, you have to look at all the pieces. Where we started our journey was trying to understand how the CDC now has changed developmental milestone acquisition. This is an idea of signpost. When is your child supposed to do what? We look at 5 categories when we look at pediatric development: gross motor, fine motor, social, communication, and this really big one, at least I feel like it is, adaptation. The human body is incredible to adapt, but it doesn't mean that the wiring came together as expected. When we come into this world, we are fully formed, but we are not fully functioning. We must go through this progression of development that is going to allow us to wire our brain up. We go from the lower brain to the midbrain to the higher brain. And over decades now, really there was a big wave that started autism back in the 80s. And since that time, it just has increasingly gotten worse that our kids are not getting wired up as expected. We have to look at this. These signposts, developmental milestones, help us know what to look for. When I began this journey 26 years ago, I would see a history, and my histories are very detailed out. And I would ask myself, well, why didn't they do this? Why didn't they do that? And begin to understand what those little pieces had to do in the big picture of things. We may not ever really know exactly what goes on, but we have some ideas that are so valuable in looking at our children. And now letting them wait to do something is going to really impact a population of children that otherwise may have been helped. When you get into the development of a child and you begin to realize what actions had to take place in order for them to move forward, it's kind of like finding the missing domino. And if we go back far enough, we're going to allow the nervous system to get rewired. So we've used the word over these weeks called neuroplasticity. This is something that not only works for children, it's known to work in every decade of life, well into 80s, 90s, and I believe even over 100, that if you give the brain and the body what it needs, it will also adapt and go into a more positive direction. And that's what we know about neuroplasticity. Even for myself, this week I've mastered 180 minutes of cardiovascular strength training exercise. I feel incredible. I have more energy. My legs feel like they could even do more. And I'm excited because I know that we need at least 130 minutes a week. And I'm 61 years old and running my own practice. My practice is here in Atlanta, Georgia. And running my own practice, it takes an enormous amount of work. And sometimes I'm here almost 12 hours a day. And I work 6 days a week. And I noticed that even for myself, that I wasn't getting enough exercise. And I've got a history of competitive bodybuilding, being an aerobics instructor, and a personal trainer. The great part about that is I have cellular memory to make those neurons communicate. And if I get back into a particular level, I can get those circuits talking again. The counterpart is if I don't use those circuits, I'm going to lose them. And if I stay built into a chronic stress pattern, we've been talking a lot about stress over the past few weeks. And if you missed any of those podcasts, I really encourage you to go back, because the lifestyle that we have all had for the last 2 years has put an enormous stress on each and every one of us. And I bet if we did a stress response evaluation, which we are able to do here at Connect My Brain, we would be able to quantify that you're in a chronic stress pattern. It's so common. But what happens to our brain if we stay in any kind of chronic pattern, chronic ill health, chronic sadness, chronic depression, chronic anxiety, chronic anything? Over time, those wonderful circuits that I had built for being able to exercise at such a high intensity, well, my brain's going to go, you're not using those anymore, and you must want to keep this chronic stress pattern going. So I'm going to go and take those resources, and you're not going to feel that movement like you did. You're not going to feel the benefits. You're not going to feel the drive and the motivation to go towards it because you want to keep this chronic stress pattern going. And your brain is always looking for, what is it that you want to do? And let me help you get there the most efficient way. But that's not what I want to do. I want my vitality. Now, I'm not going to go back and compete and teach an aerobics class. These guys here at the office, they keep me going enough. But I want the drive. I want the motivation. And I want the benefit. We've learned from the research that's done today on people suffering from Alzheimer's that the more that we can keep that brain firing at an aerobic level, that means exercising in the presence of oxygen, then we are going to change what's going on in an area called the hippocampus. We talked about this last week. The hippocampus is one of those fundamental places for learning and memory. This is not where we store it, but this is the novelty of it. This is why we go towards something new. When we are doing aerobic activity, we are going to get the stress chemicals off that part of our brain, and we are going to generate a protein that is going to enhance novel learning for 48 hours. That's amazing. Exercise has to be part of our equation. And having done this work like I do with kids, what I've seen here, especially over the last 26 years, their endurance levels are so minimal. They're not able to even keep their oxygen up to a level of what would reflect on a monitor of 99, which means that I am then getting good oxygenated blood all the way down to my most distal ends, my fingertips and my toes. People suffering with cold hands and feet, and we can match it up with a chronic stress pattern. You are not getting good blood flow. You're literally choking off the smallest blood vessels at the most distal end of your hands and your feet, and that's why you're cold all the time. But now let's connect that dot, what we were just talking about. If I'm in chronic stress, I'm literally changing a part of my brain. I'm not able to really generate this idea of novelty, and the brain loves to go towards novelty. I'm not able to really partake. Maybe in team sports, I don't find that I like them. If I'm a child, I'm trying to kind of role play here right now. Maybe I have a hard time socializing. That takes endurance too. So does learning. Learning those new ideas, that's being regulated right there in that hippocampus. And then last week we also talked about what happens with cholesterol. Now, if you're new to the podcast, you might be going, what do you mean cholesterol? Well, most of these kids I have found over the last 26 years have low cholesterol. And low cholesterol has many of the same negative things as high cholesterol, but it has a caveat of depression. Only 20% of cholesterol comes from your food. The rest is made in your own liver. And cholesterol is going to make neurotransmitters for the brain, like dopamine, serotonin. It is going to make those chemicals to modulate stress. And it also makes your reproductive hormones. It also is about looking at the well-being of a cell. The cell wall is fat. Your nerves are coated in fat. The majority of your brain is fat. You have to have a way to manufacture this inside of yourself. We're going to connect some of those dots today as our topic is about what are those red flags that I might find on a history that are going to suggest that there is some developmental delay. We talked about defining developmental delay. Developmental delay, from my perspective, is any child today going through any kind of a label, especially if your child was developing as expected and then began to regress. What I've seen over the last 26 years is a pattern. Somewhere between around 15 months to about 24 months is a very classic time that a child whose body is overloaded with toxins is going to regress. And the next thing you know, that child is receiving some type of diagnosis / a label. But the parents can show me pictures and videos of what their child was doing when they first got here. When you have something that is more of a genetic / organic reason, your child unfortunately would be born with the problem. But when your child is born and you had a typical outcome, an expected outcome, and your child is beginning to do the things that they are wired to do, and then all of a sudden that changes, that's a huge red flag. I want to know what was going on at that time. I want to know what went on during your pregnancy. So some of the things that I'm going to ask about, I'm going to ask about your cardiovascular system. Did you have low blood pressure, high blood pressure? Were you prone to gestational diabetes? Did you have a thyroid problem? I think that's probably one of the biggest areas of concern today. So many women have trouble losing weight and automatically think they've got a thyroid issue. Now, you could. And the only way to quantify that is you got to do lab work. We've talked about this a couple of times during this series. Many women, and I'm referring more to the population, the thousands of children and families that I've worked with over the 26 years that I've been in practice. Many of these women thought that they did have a thyroid problem. And they went and they asked to get some lab tests. But we have to remember what has gone on in our traditional healthcare model. And this is not about medical bashing. Unfortunately, I think the culprit is really the insurance companies. They are really making the decisions about what you get to have and what you don't get to have. And they are nowhere trained to be making these decisions. But unfortunately, it does. It becomes a bottom line of dollars. So these women would go in and they would have some kind of a lab test done. What's been going on with the traditional lab tests is they have been looking at averages every year. They've been changing the within normal limits. They've been creating bell curves, just like we have witnessed this year what the CDC has done with developmental milestones. And they're looking at averages. What did all of these women go through over the last year? And they're breaking it down based on age. Excuse me. They're breaking it down based on age. Now, if you fall within within normal limits that they just created, then you're told nothing's wrong. However, you still feel like something is wrong. And the longer this goes on, that system that is an incredible hormone regulator is changing. And it's changing you. And if you're within childbearing years, this will impact the health and well-being of your baby. Just like women who unfortunately may not be able to conceive on their own. When we go in a different direction and we get hormonal support in order to conceive and maintain that pregnancy, unfortunately, we are potentially changing the outcome for the life that's growing inside of us. Same thing's true for the adopted community. In our culture, we have really believed that the only thing we have to do is love that baby. Now, that is absolutely a necessity. There is no question about it. But we can't just think about what you're bringing to the equation. We must think about what is that baby going through. I have taken care of many adopted children, and there is a primal wound that exists in the heart of every child that has been adopted. This is a tough subject. It can be very sensitive. But again, we're trying to find what is the missing domino so that we could bring it in and hopefully get a greater optimal outcome for that child's development. There is a wonderful book, and it's literally called Primal Wound. This individual adopted a little girl, raised her. Then she actually had a child of her own and raised her exactly the same way. And she could not understand why, if I raised the two of these girls exactly the same, why didn't they turn out the same? And she's actually a researcher, and she began to do research in this area, which led her to the understanding that a baby is rhythmically, innately connected to the rhythm of its mother. And when we have to make an incredibly hard decision to put a child up for adoption, that child is going to be removed from that rhythm. And you could bring all the love in the world into that situation. But that is not always enough to make that child's development go in the expected direction. But if we look at that child and we understand the stress that's involved, and I believe in transparency. I've worked with kids for a very long time. One, I don't have a magic wand. I can't go poof and everything's going to go in the right direction. But I can connect. And sometimes it's tougher than others. Sometimes there's even tough love when you don't always have to do that. Sometimes it's got to be at a level just to get their attention, because kids are going through so much. You can literally see in their face where they're literally zoning out, and you've got to bring them back to the present. This is where we all can change our brain, is if we can get back in the present. So we have to do this at a very deep level. Now, also, let me put in this part about myself. I am not a counselor. That's not my role. My role is as a developmental specialist. My credentials have taught me so many things, and next week we're going to really dive into my credentials. But I don't come at it from a counselor's role. I come at it, let me see how this has impacted you mechanically, chemically, and your brain, the 3 tiers. So the counselor can work on the elements that have to be addressed from an emotional level. But I want to give that body the best opportunity to be able to receive all the other good work that's going on, especially the good work that's going on in the family, because the family is the nucleus to this child. And so we want to strengthen that family. We want to take every stressor off of the child themselves, and then support the whole team that's involved in bringing that child to optimal development. That's the goal in every situation. So looking at that part of the history is imperative. I've got to know what that mom went through. I have to know if that child had a different outcome than what we would typically expect. And that's the information that we're looking at when we're looking at that history. Now, yeast infections. This is another big area. A woman that typically has a yeast infection in her pregnancy is an automatic transfer to her child. The same thing is true for potentially. These are all potentials. The same thing is true for things like strep or other bacterial infections, other viral infections. Or even just, remember what we were talking about with the thyroid. If you go into pregnancy with any type of issues that have to do with your endocrine system, that's your glands, your immune system, how well can you fight something off? We're innately designed to do that as long as our body is healthy and our lymphatic systems are draining and our microbiome is balanced. That's our gut. When those things are balanced, then we go into pregnancy and we have the potential for a different outcome. But if we go into pregnancy with endocrine issues, glandular, immune issues, glucose regulation like prediabetes, it can even be as hard as cancer and depression and obesity, emotional triggers. All of these things, these are typically the top 6. If we go into pregnancy with any types of imbalances, it makes the outcome for our baby less optimal. Now, I've got to tell you, if you sat down and you talked to me one-on-one, I could tell you my own stories, and you would realize that it really is so common for so many things to go on. It's hard. It's hard to have this idea of a perfect pregnancy. But when I started really looking at these things, one of the questions that I asked was this a planned pregnancy? Most of the time, I would say greater than 75% of the time, these are not planned pregnancies. So early in practice, that was where I really wanted to go. I wanted to work with young couples and let's know your state of health before you get pregnant, so that we are putting your bodies in the best path in order for you to have a great outcome. I still believe that that is our best choice. Even when we look at our health, as I go into my 6th decade of life, I want to do things from a preventable level. I want to get back into my regular exercise. I want greater balance in my life. I had a coach last year that really opened up my eyes. And he had me plot on a graph that looks like a cross where I felt like I was with my business. And then where was I with my social life? Where was I with friends and family? Where was I in my spiritual life? And the idea is it should look like a diamond. So those points should all go out in balance. And I have to tell you, mine did not look like a diamond. I work a lot, and it is something I am becoming increasingly more aware of and wanting to bring that greater balance back into my life. I am really trying to find another doctor to come in and join me in this practice because there is enough for both of us, and there is so many children, families, couples that really need support. But it's not just about trying to make anybody highlight a particular part in your pregnancy or a decision to adopt, anything like that. We all have struggles, and we all have to be able to take a step back and say, okay, what can I do differently? Now, if you're involved in something and you're hearing this and everything is going in that perfect direction, stay with it. But if it's not, it's time to look. It's time to look for other directions. So moving on into what are these red flags? So another question that I ask is about prenatal vitamins. If we're buying our prenatal vitamins at, let's just call them like a superstore or a super drugstore where there's so many other things in there. So if a place has car supplies and fertilizer and prenatal vitamins, you have to understand that's not the highest quality. And it is important that we absolutely know where we are getting things that we're going to put in our body that we're thinking are going to support us. Because in the big picture of things, they really could cause more inflammatory reactions. I also ask things about how many ultrasounds. That is a temperature change that the baby actually goes through in the womb. Unfortunately, what we've done with this today is let's get your baby's first picture. And while an ultrasound can be very beneficial for something that's needed to be diagnosed, going in and just having regular pictures is not really the best plan of all. We want to also find out what happened in your pregnancy. Did you feel supported? Were you under a lot of stress? They now know, in doing a lot of research on the autistic population, that a common thread is very high stress chemical patterns, especially those surrounding suffering a loss. And suffering a loss absolutely could be losing a parent, losing a friend, losing a spouse. But it can also be the loss of, I'm not getting an ideal relationship. We have more single parents today than ever before. I'm a single parent, so again, there is no judgment. But that's a hard road to toe on your own. It's also that idea of maybe you lost your career. So there's many things that fall into different categories that literally can impact the outcome. Then, there's certainly many others, but just to kind of highlight, what was the birth process? Did you have a birth plan? Did things go as expected? Was this a vaginal delivery, a C-section? Were instruments used like forceps? These are all things that play a part in the outcome of the baby. And then we jump into now what's going on with the baby. And one area that I really want to highlight is language. Today, there are many parents that are noticing their children are regressing in their language skills. I've actually seen it myself. And a couple of reasons. The big one is they're having to wear masks, and that is completely changing how they hear and therefore how they articulate. So again, they could have had that language okay prior to masks, and now we're noticing that it can regress. So these types of things can happen, and we want to be aware of it. There can be other reasons. For example, lots of children getting orthodontic appliances put into their mouth after they've already acquired their language skills, especially spacers that are trying to pull that mandible apart. They now have something up there on the roof of their mouth that they weren't used to having. I would tell you, bring that to the attention of your child. Be transparent. I'm noticing you're really having trouble articulating sounds. I want you to really listen to yourself, and I don't want you to feel bad, but I'm going to ask you to repeat, and I'm going to let you know I can't really understand you, because we don't want them to lose the pattern. I think it is very important to be able to talk to children and help them understand. They are going to be active participants in getting things back. But let's look at language. So, for example, language really starts immediately. It even starts in the womb, okay? Your baby is hearing sounds. When the auditory system is developing, when you arrive, you are perceiving low-frequency sounds. You have to acquire middle and high over the first 3 years of life. And I'm connecting dots now, so this plays a part in our gut maturation. So unfortunately, if we had to use antibiotics, we could have changed the perception of sound, because that vestibular system is very sensitive to antibiotic use. The immune system is going to mature over the first 3 years. So if there are lots of different illnesses that are going on, which would also be red flags in our histories, then that can also play a part in how the hearing system is actually going to mature. One of the things that I do in my office when I assess, I am always looking at very basically, but I want to get an idea, what is that maturation process for that child? Can they distinguish sound? Are they able to hear sound traveling through the air longer than they're hearing it on the bone? And is sound actually traveling equally to both ears? Very early in practice, what I found was most children literally have issues with oculomotor. My role is not ocular acuity, but I absolutely can look at ocular motor. You have 6 muscles that wrap around the eyeballs, and these are going to navigate the movement. When you come into this world, they are working independently. There is a huge change over the first 10 weeks of life. So I would always want to look, how did that system mature? So I would find issues with oculomotor, I would find issues with auditory, and I would find issues with the vestibular system. This actually was all I could focus on when they were coming to see me, and I began to feel like I'm never going to get anything else accomplished because this is all I'm ever working on. So it literally led me to around 2011 to create a piece of medical equipment that I call the triangle of development, which it is going to allow us to stimulate neuroplasticity, the eyes, the ears, and the vestibular, because they're all interconnected. And for my podcast audience, I'm literally holding up 3 fingers and putting them into a triangular position. Kind of like I did last week when I was talking about the vestibular system and showing the angles of the canals. That we have a anterior, a posterior, and a horizontal. And it's this 3D image. Well, your vestibular system automatically talks to your eyeballs. So we can actually test your vestibular system and see a response in your eyes. And this way we can see if those systems are communicating. And then your eyes and your ears are talking to each other through 2 nerves called superior and inferior colliculus. These are just nerves up in the brain stem. And then your ears are talking back to your vestibular system through the vestibular cochlear nerve. So this is why I termed it vestibular triangle of development. So all 3 of these systems have to communicate. It also means if one of these systems is not working, the other system is also impacted. So when we're talking about language, we've also got to consider what's going on with the oculomotor as well as the vestibular system. And many people mark off motion sickness in their intake forms. That would be a huge red flag. That would mean that my vestibular system, which is acting from a 3D perspective, which our world is 3D. You see 3D. And we have to have these systems to communicate in order for that child to go through its movement progression, to go from laying on its belly to being able to rolling over, to pushing itself up, to getting into a seated position, to pulling itself up onto a table, to eventually walking on top of planet Earth. So all of these things are instrumental in creating circuits that are actually going to lead to proper development. So your language system literally starts right away. But the child is now going to start participating around 7 weeks. You should begin to hear cooing sounds. And those are actually vowel sounds that your little one is expressing based on the stimulation that that child has already been receiving up to this point. Then between 3 and 5 months, we're going to start laughing, and we're going to start with 1-syllable sounds, and we're going to bring the consonant sounds into the vowel sounds. And then around 8 months, we're going to get to a 2-syllable word like mama and dada. So there's a progression, and that's going to lead us up to a year where your little one is going to begin to then say 2 to 3 words. But this started way back in the womb. It's a progression, it's a sequence, and every step is needed. And that's what we do when we look at a history form. Where did this get interrupted? Now, it could be something way before the child was even conceived. It could have been someone's state of health. It could have been something during the pregnancy. It could have been something during the birth process. It could have been something that first year of life. And now the development has become interrupted and the child is not going in the expected direction. Moms, you are so on target with your babies. You feel this in your gut that something isn't right. I encourage you to step out, make a phone call to us. No matter where you are, we can certainly talk about it and I can help validate your concerns so that you don't wait. The longer we wait, the harder it is to turn these situations around. Not just because of the age of the child, but because everybody's gotten into different habits. And it's not only that you're working with the child, but you also have to work with the family. And lots of times, parents, when your child is now over 7 or 10, you are exhausted and you don't really have the margins to try to reorchestrate. Now, I don't want parents of children over the age of 7 or over the age of 10 to wait, but don't wait anymore. If we're willing to roll up our sleeves and go to work, change is possible at any time. Even for me at 61, I can't get over how much better I feel since I got my 180 minutes in this week. It's time for all of us to start putting that good stuff back into our bodies because these brains, they're just waiting on you. And they'll help you and they'll look for your new patterns and you'll get moving like you did before. So if you want to talk about a potential red flag, I encourage you 2 ways. You can call the office, 678-501-5172. You can also go over to the website. We have a form there that you can fill out. Let me know what your concern is. Try to tell me too when you might be available. Sometimes I get all kinds of emails asking questions and then we've got a breakdown in communication and I can't get you back on the phone. I'm here. It's a complimentary call and we are willing to either help you ourselves or maybe help you find another direction. This is what community's all about. Also on our website, we have a survey. We want to know, what do you want to talk about? What do you want to learn about? What marvelous part of this brain would you like to find some pearls that can begin to change your life, your family's life, or your child's life? And then we've also got some freebies. So be sure and download and enjoy. We are so looking forward to connecting with you and making this one of the best podcasts out there. Be sure and share this with your friends and subscribe. I hope you have a great rest of your week, no matter when you're listening to us. Take good care.